All right, so I was going to show you how to do an injection. Injections sound pretty intimidating at first, but they're pretty easy. First, get your alcohol swab, rub the top. The friction helps actually get off anything and helps a little better than just lightly touching it. And then you take your alcohol swab and you put it wherever you're going to go. Whoops. I'm going to show you how to do a shoulder, and we'll talk about the other intramuscular spots, but we will use 27 gauge 1/2 inch needles, and I like to get a full barrel of air and then put that in. That's going to help displace and not make this a huge vacuum if you're pulling out the med for several months. And then and it takes a little bit, but it's not tons. But then say your dose, we have you on 20 units 3 times a week. You put it at that 20, take it out, and then just rest your shoulder. Sometimes if you can pull down a little bit, it'll help. It's kind of hard to do it, but if you pull down, it stretches the skin a little bit. Poke 1, 2, 3, all the way in, and then you push. You will need a little bit of resistance, and then out. Sometimes there's a little blood, and you just wipe it with your alcohol swab, and then you go on throughout your day. Easy peasy. Other potential intramuscular spots. Typically you can alternate shoulders. You can go to your thigh, but it's typically outer third and do upper. Don't go way down here. Go about right here where it's upper, outer third. You can do what's called ventral gluteal. This has a smaller target, but it's overall pretty good. You feel your hip bone, your iliac crest, the top hip wing. And if you lean this way, you can feel this muscle flex. That's where you would put the alcohol swab, inject there. And you can inject back here in their butt. But typically this is a little easier. There's no nerves or vessels here. This is a little bigger there. Alternating shoulders is also pretty easy. Just honestly, it's wherever works best for you. You can go subcutaneously as well. So you draw it up, pinch up some fatty tissue, and then go at about a 45-degree angle there. And so it's wherever works best for you. Subcutaneous, you still get good levels, and it's not going to have any less of efficacy. Some people do get some nodules in the fatty tissue after injection. To help, you can press it hard after you inject, do a warm compress, or they'll just go away in 3 to 4 days. But if they're bothersome and you're doing sub-Q injections, just look at this.